sang va vers la jeunesse. Le tentateur
sans cesse.
célèbre sans cesse. Loin du vrai bonheur.
Combattant le doute.
Combattant le doute. Parle-lui d'amour.
Montre-lui la route.
Montre-lui la route du succès. Séjour préagir.
The environment that we're in right now is good. You know, initially you're getting people up who have had surgeries or had traumatic experiences, and you're just getting them back to their function. Now we're starting to see this lag between when they're independent or modifiedly independent with whatever procedure they've had, but a lot of these people are going to go back to surgery, and so there's this lag between needing something now and needing something again in a month. And we're seeing a lot of residual effects of not having done things sooner. We're getting a lot of contractures and just trying to fine-tune people right now in their strength and their range of motion to get back to like normal gait patterns and normal being able to do things on their own without having residual effects.
Non. Como ça?
Non capable, non.
Moi, c'est... Eh bien, tu vas avoir ça, fait du point. Tu vas avoir du point, non? Allez. She say that she can't. I say her, I know that she can't, but I try to make the exercise.
Try.
Allez.
Try.
On va pas mes exercices on
Are you
fait.
done?
Allez.
Ça dit ça.
Allez.
Just more. Just one.
Non.
This one.
Just one.
Sérieux, c'est sérieux. Serious. Allez.
10 more times.
C'est sérieux.
Et surtout ça peut être abonné.
Qui ça vous garde? Qui ça vous garde?
You know, just that makes you think and appreciate what you have and appreciate the strength that so many people have, and it makes you just step back a little bit.
What's been the biggest challenge of doing PT here versus the United States?
Everybody's on beds at home. Here you're lifting them up from the floor. That's different. Making things up as you go along using, I mean, at home you want something, you just go to the room and you get it. Here it's just like, okay, well, we don't have crutches small enough for you, how are we going to get you around? And so, but you figure stuff out, it makes you think. You use your brain.
Okay. 1, 2, 3.
Sort of on the fly. We have a certain amount of equipment to do certain things, and we have to figure out what we can take care of here and what needs to be sent to another facility that has more resources than what we have here. The USS Comfort had been taking complicated patients. It's now through and going back to the United States. There's another hospital in Haiti nearby that has been doing things that it's also closing, and so we're losing a couple of the resources that we would have had. But we just have to try and match the patient's needs to the resources available. We do some surgery here. We're kind of coming to the end of the simple things that we can do here with the resources that we have. So we're trying to figure out what's going to happen over the next few weeks as people are healing up from their broken bones.
So this time we just taking one bag. Mine. Okay, so just stock it good. But we don't, I'm going to do...
I want to take out some sutures or staples. Do you have anybody I can take some staples? Isn't that creepy?
They're all out. That the Haitian people are hopeful. They're very grateful for all the help that they receive from the camp here, from the field hospital. They thank you all the time. They smile. They tell you they love you. You can't communicate with them. if you don't speak the language, but sometimes it's just the little things. They blow kisses at you. So I know that we do a lot of waste in the United States. And when I see people or myself take a shower from a bucket and get my clothes washed in a bucket and hung on the line, and the kitchen staff washes every dish in a bucket and rinses it and gives it to you clean back, and there's no hot running water, there's very little flushing of toilets. It just makes you realize that life can really be simple and rewarding at the same time.
We've been told that we're one of the better, if not the best, field hospitals in Haiti, and I think that what's unique about us is that we came in with a strategy. We listened to the concerns of the people. We built this place up, making sure we addressed sphere standards, that we were on board with all of the local NGOs. We worked very closely with the UN agencies, and we kind of had an ultimate goal and plan. The thing that a lot of the other transfer institutions like is that we re-accept the patients so as to not split families, and they can do their definitive care and then they can come back here. So we're getting a good reputation in that. We really follow and take care of our patients to make sure no one gets lost in the system, which is a huge challenge when you have a migration problem, which we have. I mean, I think the support we've had from our academic institutions, as well as from all of the different volunteer organizations that have come down, and the staff and personnel that have worked here, have helped build this place to be what it is. You have a lot of people with really good ideas that have been listened to, and I mean, from what, 16 different countries now, or 15 different countries, and that collaborative effort, I think, is what really makes this place unique and distinct.
Peux-tu l'accomplir? Pour lui sans relâche, sans jamais faiblir. Réagis jour après jour, sans broncher, suis ton sauveur avec amour. Sois fidèle, obéissant, et le maître rendra ton travail puissant. Va chercher ton frère, esclave en la scène, là de sa misère, de son noir passé. Arrache son âme au plaisir trompeur. Le salut proclame en Christ son sauveur. Réagis, jour après jour, sans broncher sur ton sauveur avec amour. Sois fidèle, obéissant, et le maître rendra ton travail puissant. Va vers la jeunesse, le tentateur, sans cesse, loin du vrai bonheur, combattant le doute, parle-lui d'amour, montre-lui la route, du ciel séjour. Réagis, oh oui, jour après jour, sans broncher sur ton